pleased to introduce Kelly Murray, a supervising attorney with the New York Legal Assistance Group, where she focuses on public benefits and healthcare access for older New Yorkers. Welcome, Kelly. Thank you for joining us.
Thank you for having me. So I'm going to take over for the rest of this hour. Once again, my name is Kelly Ann Murray. I'm a supervising attorney at the Evelyn Frank Legal Resources Program at NYLAG. NYLAG is a nonprofit legal services organization that focuses in on assisting individuals who are in crisis or experiencing poverty. And we address this with many different civil legal services organization, financial empowerment, impact litigation, and advocacy. So NYLAG is approximately a staff of 400 individuals, and we are focusing on helping any individual who is experiencing poverty or crisis at any particular time. Particular unit is the Evelyn Frank Legal Resources Program. That program focuses in and fights for older adults and people with disabilities to ensure that they have access to healthcare and the services that they need so that they can age in place in the community. And we do that through several different methods, whether it's one-on-one counseling with individuals or counseling with advocates in regards to Medicaid, Medicare, and Medicaid home care, or we do trainings just like this, whether it's to beneficiaries themselves or to advocates and other workers in community-based organizations. And we do that to focus in on healthcare and accessing care in the least expensive way possible. We also represent individuals in denials or reductions of Medicaid, the Medicare Savings Program, or Medicaid home care. And finally, a lot of our work is done on assisting clients with accessing Medicaid home care and ensuring that they're getting a care plan that best meets their needs so that they can stay at home. Our next slide. Our pride and joy is that we do have a website. It's newyorkhealthaccess.org. It's a website that provides you information in regards to Medicaid and Medicare, Medicaid home care. It's up-to-date information, as up-to-date as possible. We are pivoting quite quickly in many different directions in the last couple of weeks, and we foresee that's going to be the future. But at any point you have any questions and you want to learn a little bit more about Medicaid, whether it's your income guidelines, how you apply, or what services you can do, or how you can appeal, if you need more information in regards to Medicaid and Medicaid home care, this is our website. We share it with legal aid as well as Empire Justice Center, in that we're trying to keep all the information as up to date as possible so that individuals can look up this information. And it is easy to read and it's not complicated. It's not in legalese. So I encourage everyone to check it out. It's my favorite thing. I'm checking it out almost daily. But finally, next slide. That's the end of my commercial for NYLAG and for the Evelyn Frank Legal Resources Program. I'm now going to talk about why am I here today and why are you here. And October 15th, next slide. October 15th through December 7th is what you call Medicare open enrollment. It's the time in which Medicare beneficiaries are able to pick their new plan, whether it's a standalone drug plan or a Medicare Advantage plan for the upcoming year. So you have through October 15th to December 7th to do all the research and then pick that plan, enroll into it so that it's effective January 1, 2026. Many individual Medicare beneficiaries only have this one shot to make this choice. So the worst thing that could happen is that on January 4th, when you walk into CVS, you find out either CVS is no longer an in-network provider, your medications are no longer covered, or all of a sudden your premium has increased by $50 and your medication is 3 times what it was in 2025. So we want you to take a proactive approach to your Medicare and take this opportunity to do the research, to look, if you can't do it yourself, to find someone who can. And at the end, I'll give you contact information who can actually assist you. You probably noticed that your mail and your post on your mailbox, you're getting more and more flyers about health insurance, or the television commercials are becoming more and more, or your phone is ringing from people who want to sell you insurance products. And that's because it's Medicare open enrollment, and they want you to hear their sales pitch so that you pick their plan. And I'm just asking you, before you pick your plan, you do the research, because they might be really nice people, but they may not be able to actually meet your needs. So Medicare, just step back. Not everyone gets Medicare in the same way. Medicare is the overarching program that comes through the federal government. So Medicare itself is the actual program. What happens is, next slide, individuals have options on how to get Medicare. There's option 1 and option 2, or if you're in a restaurant, it's either column A or column B. So option 1B, original Medicare, you have a red, white, and blue card. That red, white, and blue card is going to give you your Medicare Part A, which covers your hospitalization. B, that covers all your outpatient services, your doctor visits, your radiology tests, your lab tests, your physical therapy, small amount of medications. When you go to the doctor, you give them their red, white, and blue card, and the federal government then gets a bill from your doctor or your provider. And then what happens is the federal government will pay according to the regulations of how payment is made. Then individuals in option 1 sometimes have what they call a Medicare Part D plan, which is your prescription drug coverage. Prescription drug coverage will depend if you're through the Medicare program, or if you have retiree or union insurance, or if you have veteran insurance. That's option 1. Option 2 would be the other side. You could do a Medicare Advantage plan, which is you're going to lump in Medicare Part A, Medicare Part B, and Medicare Part D, but through an insurance company. The federal government's going to pay the federal government's going to pay the insurance company a specific amount of money on a monthly basis, because you're their member, whether you use it or not. And then the insurance company is going to pay the doctors, the providers, your pharmacies. Under a Medicare Advantage plan, most of those have networks of providers, so you have to stay within the network. There are some plans that allow you to see out a network provider, but they are more expensive. Under a Medicare Advantage plan, there's more, there's a need for referrals. I go to my primary care doctor, they tell me I have to go here. They'll give me a referral to see that doctor, and also prior authorizations. Now, everybody always says to me, Kelly, which is the way to go? Which is better? That's an individual decision. I always give the example of my parents. My father would want option 1. If he had a headache, he was going right to the neurosurgeon. He wasn't going to stop at his primary care doctor. He wasn't going to then go to a neurologist, and then who's going to be sent to a neurosurgeon. He was going to go right to the neurosurgeon, and he was going to go to the neurosurgeon anywhere in the 50 states in the United States. He's going to use his red, white, and blue card, and he'll be able to access his care in any way, shape, or form. My mother, on the other hand, is clearly an option 2 person. She's going to have a book from her insurance plan. That book's going to give her a list of doctors. She's going to go to her primary care doctor. She loves to go see him. She's going to say, Dr. Sacker, I've been having headaches. Dr. Sacker is going to say, okay, give me your book. Okay, I see so-and-so's covered. I really liked him. I went to med school with him. Or him and my child plays football together. You're going to go see this doctor. Gives him a referral. My mother's going to go and see that doctor. I'm going to go through how the costs break down under these options in a little bit. Just so you know, next slide, there is a variation to option 1 in that some people have what they call a Medicare supplement or a Medigap. So they have original Medicare, they have a prescription drug plan, and then they pay an additional fee to get a Medigap or a Medicare supplement. It's through a private health insurance plan. It's broken letter. Even though it's through an insurance plan, the Medigap does not have a network. So if Medicare pays, then the supplement pays. It is, however, quite costly, and you would want to just determine which is better for your financial picture, if you want to have a Medicare supplement or not. So I was saying that individuals have prescription coverage, and once again, how you get it is going to depend on you and whether you're in option 1 or option 2. So option B, that you have a Medicare prescription drug plan. The Medicare prescription drug plan is a separate plan. Anyone who has option 1 is going to end up with 2 insurance cards in their wallet, your red, white, and blue card, along with your prescription drug plan. If you do option 2, your Medicare Advantage plan, 95% of those plans cover your medications, and you would then therefore only have 1 insurance card in your wallet. Yep, there are different rules for individuals who have, there are different rules for people who have retiree plans and or union insurance plans. So when a person has Medicare Part A and Part B, Part D is technically, however, most people get through Medicare. However, there's the lucky few who may be getting it through their union or retiree plans based on a former employment. If you have that type of insurance, or if you have veterans insurance for prescriptions, Medicare open enrollment is not for you. Those particular union and retiree plans and or the veteran plans have their own technical open enrollment or benefit periods. So my recommendation is that if you have your prescription drug coverage through this particular plan, you call and speak to your benefits administrator or your human resources or your retiree liaison, whoever you usually speak to about your options, and they would be able to tell you when that open enrollment is and what your options are for switching a plan if you're not happy with their current coverage. If you were to switch into a Medicare plan, you may not be able to go back to what you had before. So that's why we strongly recommend you speak with your plan administrator before you make a switch. Next slide. Everyone always says to us, well, I want Empire Blue Cross Blue here. Just hit next slide. Thanks. Blue Cross Blue Shield. And the name of the health insurance plan isn't really going to tell us much. It's going to tell you that Empire Blue Cross Blue Shield is the insurance company that you have insurance through, but the actual type of insurance you have, or what will and will not be covered and what rules you have to follow, will not be easy to understand unless you have additional information. So it's important to remember that insurance companies offer an array of plans with different options. AARP United has a Medicare Advantage plan. They have a Medicare Part D plan, and they have a Medicare supplement plan. So that's why you would need to delve further into the actual type of insurance. So I always joke, everybody cannot wait till they turn 65 because they can't wait to get Medicare, because in their eyes, if they don't know anything about Medicare, they think that Medicare is free. And that is certainly not true. Next slide. Medicare is not free. If you're already a Medicare beneficiary, you know that. Medicare has loads of out-of-pocket costs. We start with our premiums, depending on how much, if you have a work history of 10 or more quarters, will depend on how much you actually pay for your Medicare. Most people get Medicare Part A with no premium. as long as you've worked those 40 quarters and you've paid into the system. If you have worked less than that, then you will see a substantial monthly premium. Individuals with Medicare Part B currently is paying $185 a month, and that's membership free. On a monthly basis, that gives you the right to carry a red, white, and blue card, and Medicare will make payment on your care, whether it's through them, through the federal government, or through the insurance plan that they've contracted. Then Medicare has what they call deductible. So you have your membership card, you're paying your membership fee. Your deductible is more like your entrance fee to get into the building. Depending on the type of coverage it is, will depend on how much your deductible is. It is charged. So your deductible is you pay the first $615 in your medication costs, and then after you've reached that amount, the insurance company is going to pay. Or you pay $215 in your health care, and then after that, you will, the insurance will come in, and the breakdown of costs will depend on the type of coverage you have. Finally, there's copays and co-insurance. The copay would be a set amount. That's usually, you'll see that in your Medicare Advantage plan. I go to the specialist, and the specialist will cost me $45. I know exactly how much I need to have in my pocket when I walk into the door. A co-insurance would be a percentage. Medicare usually charges the beneficiary after the deductible has been reached. A breakdown of Medicare will pay 80%, and then the individual will pay 20%. And then, just so you know, there's some different ways in which your cost of your medication is determined, and that's basically through a formulary, and also for Medicare Advantage if the doctor's in or out of network. So we have currently the 2025 costs that we've broken down for you. Unfortunately, the 2026 plans, the 2026 coverage costs have not been broken out for original Medicare. We are waiting. They usually come out the first, anywhere between the first week and the last week of October. Thinking maybe a government shutdown might be affecting the release. Not really sure, but stay tuned. At any point you have any questions in November or December and you want to know if the costs have been released, you could always Google it or contact us. We'll be glad to update you as soon as information, the 2025 or 2026 original costs are there. The Medicare Advantage plan information is there and has been released. Medicare Advantage plans charge an additional premium. So everybody has to pay their Part B premium unless they have some cost sharing benefit or in one of the programs that I'll discuss at the end. And the premium's going to depend on the plan you're in. A premium could be a health fee, could be a drug plan fee. It's just going to depend on what that particular insurance company is going to charge you on a monthly basis. Some of them have a zero fee. So, you know, it just, across the board, it depends. Co-pays for the Medicare Advantage plans will also vary depending on the plan you enroll. You know, I've seen some that have a $0 for primary care doctors, for in-network, $50 for in-network primary care, for out-of-network primary care doctors. Well, I've seen, you know, 15 and then 50%, just depending on the actual plan itself. Next slide. Your Medicare prescription drug plans have been released. Currently in 2025, there's 12 Part D standalone prescription drug plans offered. In 2026, there will be 10. The premiums will range anywhere between $35 and $174. Some people may pay a little bit more than that if you didn't enroll when you were first supposed to enroll. And there is no monthly premium for two benchmark plans currently, but it will be two benchmark plans in 2026 if you have extra help. Extra help is a program through the federal government that provides financial assistance for your standalone drug plan costs, or if you're in a Medicare Advantage plan, your medication costs. It helps you pay your Part D prescription premium, the premium up to a specified amount. There are two plans in 2026 that will have a zero premium. If an individual is in Silver Script Choice now, your premium is going to substantially increase by at least $50. If you have extra help, it will substantially increase to where you're paying that out of pocket. So if you have extra help and you're in Silver Script, I strongly encourage you to do the research to see if there's a cheaper plan for you. If you were in a drug plan in 2025, you should have received information from your individual plan that told you about the changes in the plan. There is a deductible. The maximum amount of deductible is $615. Some plans have smaller deductibles. Of course, if you're paying a premium of $173 a month, your deductible is zero. And then there's two other plans that have smaller than $615. Then you're going to be paying a copay. So you pay your premium to get in, you might have a deductible, and then you have a copay. The amount of your copay is what you would be paying with your pharmacy. It's going to depend on whether it's on your formula, on the insurance company's formulary list. A formulary list is a list of medications that your particular insurance company will cover. There's hundreds of blood pressure medication or cholesterol prescription medications that you could be prescribed. An insurance company does not have to cover all of them. They have to cover a specific number, but not all 100. So they pick and choose which of that classification of medication they're going to cover. In addition, the prescription plan may have what they call utilization management, or I just like to call it the hoops you have to jump through to get your medications. So one of them might be a prior authorization, in that the insurance company is not going to authorize their payment of that particular medication unless your doctor has contacted them to explain why that particular medication is medically necessary. There's also what they call step therapy. There might be 3 different types of medications. They're going to want to your doctor explain why option 3 is the medication you have to take, and that you should not have to start at option 1. And here's the medical reason why. So you have to take steps to get to option 3, or your doctor has to explain to them why there's no reason for you to take those steps. And then finally, they have what they call quantity limits. The drug plan is going to say, I will allow you to get 30 pills of that particular name on a monthly basis without you having to get us any medical documentation other than a prescription. If you take more than that, then your doctor's going to have to explain why you need to get 60 pills instead of 30. So that's the hoops that you have to jump through. Then each of your medications have what they call a drug tier. A drug tier means the insurance company has created at least a 5-tier system where your preferred generic is your tier 1 and your specialty medication is tier 5. As you go through those tiers, of course, your copay is going to increase depending on the fee structure that they have determined. And finally, how much your medication is going to depend on where you are in your stage coverage. Are you in the deductible period? Are you paying the full amount of $615 all the way through? Did you reach your magic number of $615? Now you're only paying 25% of the cost. And have you reached the maximum amount that I'm going to talk about in a little bit? So Medicare has taken its attempts to reduce costs and care for services and medications. So the first way that a person can get care without having to worry about the cost is that Medicare does cover certain preventive services, with not being subject to the deductible and or no copay or coinsurance. And these would include, when you first get to Medicare, you're allowed to have your welcome to Medicare, and then on an annual basis, you're allowed to have your yearly wellness visit. Then there's certain screening programs for diabetes or cardiovascular or cancer screenings or depression screenings. As long as that is all for screening purposes, they're considered to be preventive and no copay. I do usually have people telling me, well, I went for my mammography or I went for my colonoscopy and I have a copay or coinsurance. You just have to remember that it has to be a preventive visit, in that I walk into the doctor's office, the doctor says, "Oh, you're that magic age. Have you had a colonoscopy before?" I said, "No, I haven't." They're like, "Okay, we're going to send you for a colonoscopy." It's a preventive thing. It's not nothing's going on. We just want to make sure there's nothing silently happening that you don't recognize. I go in for my colonoscopy, I walk out without being subject to a bill. But if I had gone into the doctor's office and I said, "I'm having these horrible, terrible stomach ache problems," and the doctor said, "When was your last colonoscopy?" And I say, "Oh, I've never had one." They're like, "Okay, I want to send you for your colonoscopy because I want to see what's going on." That's considered to be a diagnostic visit, and therefore I will be subject to the deductible and the copay for your insurance. There is a long list of free preventive services that you can access. All you have to do is click the link that's on the slide and to see the full list of free visits. There has been some cost saving measures under the Inflation Reduction Act. One of the things is that Part B and Part D vaccines should have zero copays and not subject to a deductible. Currently, the vaccines that were available in 2025 will also be available in 2026 at no copay or no deductible. That is subject to change depending on the guidance from the CDC. But you can get your COVID shot, you can get your flu shot. In addition, insulin copays are at $35 a month for your Part B insulin covered products. And finally, Medicare has started to negotiate prices. These negotiations started in 2024, and your first 10 medications have now been negotiated, so the prices have been reduced. So if you are currently paying for Eliquis or Xarelto and they're costly, you will see a substantial reduction in 2026. Finally, next slide. Medicare recognizes that $615 deductible is quite high. They also recognize that Medicare's prescription drugs are not very cheap, and people take a lot of them. So usually January is your eye-opening experience when you walk into the pharmacy. You forgot that you had a deductible, and now you have a deductible, and the pharmacist tells you, okay, your medication's going to cost $615. And you just look at them like with this blank stare, like, how in the world am I going to do that? I need this medication, and I don't know how I'm going to afford it. Medicare has started a new program as of January of 2025. So we're completing our first year, which allows individuals to set up a prescription payment plan. The prescription payment plan allows you to contact your insurance plan and say to them, "I would like to sign up for this." What will happen is you will then make monthly payments to your insurance company for the cost of your medication. I walk into CVS, my medication would cost $600. What will happen is CVS will give me my medication and charge your insurance company. Your insurance company will then divide how much that cost of your medication was in CVS amongst the remaining months, and you will pay that on a monthly basis to the insurance company until your medications are paid off. So it's not going to reduce your costs. It's just going to make it more palatable for you to actually afford it. So your 600 medication would then cost $50 a month for the next 12 months. A little bit more because it will be 11 months. That is through the insurance. If you're interested in doing that, you would contact them to sign up. If you are currently in that and you liked it, then you don't have to do anything. It will automatically enroll you again for 2026. Finally, Medicare Part D has what they call a cap. The Medicare Part D cap is $2,100. So the good news is that there's a cap. You won't have to pay more than $2,100 on an annual basis for your medication. The bad news is that there's a it's $2,100. However, that at least gives you when you hit that magic number, you will then pay zero. So at least either if you have medication that is going to cost you $2,100, it might be advisable to look into the prescription plan. So why am I here talking about this particular issue is once again, it's Medicare open enrollment. It's a time in which you can look at what 2026 plans would look like. It's time for you to do your research, and it's time for you to actually make a switch if it is warranted. It's going to actually minimize your headaches in Medicare. I wish I could say it's going to eliminate them, but it's going to minimize them in that you know your prescription medications are covered, you know that your pharmacy is covered, you know that you're going to be paying the least expensive amount of money for your prescriptions, you know what hoops you're going to need to jump through so that you're prepared to do that. And most importantly, you're not going to find out on January 4th that your plan no longer exists. And now you're paying 100% of your cost. If you're in a Medicare Advantage plan, all of what I just said in regards to your prescription medication. However, it's also going to, you're going to make sure that your doctors are in network and that your costs are manageable. So how would you make those changes? You're going to make those changes in what we call the online Medicare Plan Finder. The Medicare Plan Finder is a website through the federal government. It looks like that if you Googled Medicare Plan Finder, make sure that you're actually going in the Medicare.gov website because there are some insurance companies that link it and it looks like you might be in it. So just make sure that it is the Medicare.gov website. It will kind of look like my actual screenshot. However, instead of my friend that's here in the upper right corner, it's going to be three ladies instead. They changed the visuals on it, but it's a website. You just go in, you're going to answer the questions. It goes by zip code, and then it will say what type of plan do you want to look at. You've got a standalone Medicare Part D, a Medicare Advantage plan, or if you want to look at supplement plans, then it will ask you some questions if you have Medicaid, if you have extra help, if you have Medicare Savings Program, if you're collecting SSI, and then it will ask you by step guide onto put in your medications, your name, your dosage, how many pills you need. It's going to ask you your preferred pharmacist. It's going to ask you if you want other pharmacists also. If you're looking for a Medicare Advantage plan new this year, you can put in your doctor's names, and that will also come up if they're in network or out of network. Then once you've put in all the information you want, you hit enter, and it will sort and come up with you, and it will tell you in the order of what they've determined to be the least expensive options for you. And then you should look at each one to make sure that it's going to meet your individual needs. How you're going to do that, if you're not tech savvy, it is user friendly. If this overwhelms you, my particular unit does assist with counseling. It also, there are Medicare state health insurance counselors. There's the Medicare Rights Center. If you're in New York City, you call 311 and you say, I need help with Medicare, and they'll be able to get you to someone who would be able to assist you. So I know I quickly went through all this. I just want to go through some myths that people are always coming to us and telling us. The first myth is that everyone's neighbor or cousin has the best coverage, and that's the best coverage, and the person says, and that's what I want to be in. And I'm going to tell you that you should proceed with caution, because healthcare coverage does not always match what the person's saying to your needs. One size does not fit all. So you shouldn't just compare just based on what someone else is telling you. You do not know what your neighbor's medications are. You do not know what pharmacy they use. You do not know what their medical needs are. And you certainly don't know what their financial status is and if they're getting Medicaid or the Medicare Savings Program or extra help to assist them, because 9 times out of 10, people don't tell you that information. So unless you and your neighbor are walking the same exact path, the chances of your neighbor's best insurance being the best insurance for you is very unlikely. So that's why we encourage people to do their own counseling or get someone to assist them. Once again, and in addition, you don't know if your neighbor has retiree or has a spouse who's currently actively working and their insurance is through that, or if they're using veterans insurance or union insurance. So if you are using union insurance, retiree insurance, or veterans insurance, we encourage you to reach out to that particular health counselor for that particular program so that they can best guide you on if switching is the best way to go. Next slide. So as I said, most people always say, well, how do I know what to do? Or how do I determine what's the way to go? Oh, or I'm going to pick this drug plan because it's the cheapest premium. Just because it's the cheapest premium, or just because the Medicare Advantage doesn't have an additional premium, does not necessarily mean that it's going to meet your needs. So you have to make sure that the choice that you've determined is what best meets your needs. As I started with my comparison of my mom and my dad, those are individual choices. And whether a person wants to be in a Medicare Advantage plan because they can get some perks, such as they're going to the gym free, or they get a beautiful tote bag and some pens and a stress ball, or if they get a small amount of an over-the-counter card, those are all great, but they're only great if they cover your doctors, your medications, your pharmacy, and the hospitals you want, and they don't put in too many barriers for you to get there. So there are individual decisions that a person needs to make. When looking at an Advantage plan, you have to look to see if you want an HMO where we'll only let you stay in network, or if you want some flexibility that you want to go into a PPO, they'll let you go in and out of network with the understanding that you'll pay more money to go out of network. You have to look at if you want an original Medicare, if you want a Medigap, can you afford a supplement? How is that going to help you? It will help you if you need to use the doctor quite frequently, but if it's taking all your money and you can't pay your rent, then is it really helpful? So these are just all individual decisions. And by doing this research and review to see what your plan options are, then you want it to meet your needs, and then block out all the outside noise of what is best for everyone else. So once again, who should be switching or who should be enrolling during this time is if you're a retiree or union insurance, do not move without speaking to your benefit administrator. So I know that I gave you a lot of information about Medicare and Medicare costs and what it may cost. Everybody doesn't pay the same exact money for their care under Medicare, so there are no right or wrong answers. But there are some programs out there that can help everyone as long as you meet the criteria. So I'm just going to go through some of those programs Just so you know that. I'm not going to go in depth to those programs. If I was to discuss each of those programs, I would be talking for at least another 6 hours. And I know that's the last thing any of you would want to hear. So I'm going to give you snapshots of programs that are out there that may be able to help you. And then we'll give you some contact information of who can talk to you at more in depth about them. So the first program that I'm going to discuss with you is the Elderly Pharmaceutical Insurance Coverage, or EPIC. That's a program in New York State for anyone over the age of 65 who's enrolled in Medicare Part A and B and could enroll in D or already has Part D. This program has an income guideline for a single person up to $75,000, $100,000 if they're married. Will not look at resources. However, we'll ask a question about resources on their application that you need to complete. What it does is it's broken down into two different types of plans. There is a fee plan and then a deductible plan, depending on what your income is. If your income is on the lower part of the scale, Epic may pay your Part D premium up to $47, I believe, in 2026. It will reduce your premium. If you're in the fee plan, it will help you once you've reached your Part D deductible. It will reduce your cost of your medications substantially. If you're in the deductible plan, which is your higher income brackets, what will happen will plug along until you reach your epic deductible amount. And then once you reach that amount, it will reduce your medication. So if your medications are above $30, the most you will be paying is $20, which is great because if you're paying $150 on a monthly basis for medications, in Epic you would be only paying $20. It is an easy application. They have an application online. It's through New York State. It's your New York State or your state prescription assistance program. Even if you're not going to access the benefits of this or you won't reach the deductible, I encourage anyone and everyone to enroll in this plan if you would be otherwise eligible. Because you know how I started the presentation that this is the one time a year in which everybody can switch their plan for 2026, and a lot of you will be stuck in that plan for another 12 months. If you're an Epic member, it gets you a one-time special enrollment period. So if you're going along and all of a sudden there was a change in your medication and it's August and you're like, oh my God, everything has just exploded. What am I going to do? If you're an Epic, you get a one-shot deal in which you can enroll into a different plan. So if you're not an Epic, I strongly recommend that you look into applying for it. The next program is, I touched upon it a little bit. It's a program through the federal government. It offers individuals assistance with their prescription drug plans. It's also called the Low Income Subsidy Program. It allows pay your Part D premium up to $58.82 a prescription plan of the plan. So if you're looking at a Part D plan, the premium is not all probably a basic part. There is also an enhanced part, so it might not fully cover the 882 of the full amount. It depends on your plan. However, the two benchmark plans, if you're in extra help, will have a zero premium. It does eliminate your Part D deductible, and it substantially increases your co-pays to $5.10 for generic and $12.65 for brands. So if you're taking a lot of medications, that will add up. However, if you were paying the full price, it would be a substantial amount. Just note, if you're currently on Medicaid and you're receiving Medicaid home care, your co-pays for your drug plans will be zero. Next slide. So here's your income guideline for the federal government. It does have an income and a resource guideline. It will look at your resources. It looks at your income. When they count income, they're looking at any money that's coming into the household, whether it's earned or unearned amount of money. It is low. However, if you make this amount of money on a monthly basis, you may want to look at the next program. The next program is the Medicare Savings Program. The Medicare Savings Program is a program through the state. The program provides you with assistance with your Medicare Part B premium and can also provide you with some cost sharing with your doctors depending on what level you're at. In addition, it gets you extra help. So if you're looking at the slide, you're like, well, people on the QI level has an income guideline of 2426, and there's no resource guideline. So you're just looking at income. So if you were to apply for the extra help program with $2,200 worth of income, they would deny you because you're over income. However, if you're in the Medicare Savings Program, as an extra bonus, you also get extra help. So the Medicare Savings Program will help you with Part B premium and also get you extra help to help you with Part D premiums. This program is offered through the state. Currently, you apply using a paper application to either New York City HRA or the local Department of Social Services, depending on where you live. Finally, the last program I'm going to touch upon is Medicaid. Medicaid is your state program for low-income individuals to provide assistance with the cost of medical care. Medicaid has an income and a resource guideline. The resource guideline is a hard guideline. If your resources are above that, you may not be eligible. It does not count a house. You are allowed to have a car. It doesn't count that. It doesn't count any of your retirement accounts, 401ks, IRAs, 403bs, as long as they're in payout status. Your income is not a hard guideline. So although the income guideline currently is $1,800 for a single individual, if you're above that, there are hoops that you need to jump through, but Medicaid could be an option for you if you're willing to jump through those hoops. Medicaid supplements Medicare, so it will cover certain services or care that is not covered by Medicare, such as non-emergency transportation, dental, vision, hearing, and home care. Here's the big thing. Medicaid is the only program that will pay for chronic home care services unless the person has a long-term care plan. And it does help reduce your out-of-pocket costs. If you have Medicaid, you also have extra help, which will help reduce the cost of your medication. Medicare supplement, I've already talked about this. It's a program that wraps around your Medicare coverage. For original, you cannot have a supplement if you're in an Advantage plan. It's based on the letter, and the insurance companies that particularly offer that letter in your zip code. Just so you know, there's no reason for you to pay more money for a supplement plan. The letter covers you regardless of your premium. So if you're in Plan N, there's no reason to pay $500 a month if there's a product out there that charges $275 a month. Finally, our next slide is going to be just a warning in regards to, next slide, Medicare scams. They're on the rise. I have an 88-year-old mother who I live with. Her phone is ringing all the time. People want her Medicare information. People want to take advantage of these individuals. Next slide. So just say no to these scams. If people are calling, Medicare never calls you. The federal government rarely would make a phone call. If you try to call them, they rarely answer. So why would they want to proactively speak to you on the phone? They're not going to call you and ask you for your Medicare number, your Social Security number, or your date of birth. My advice to everyone is that you be aware. You don't give out any information out over the phone. I've instructed my mother and all my clients that if somebody calls, you say, can can you please send me that information in writing? When they say to you, sure, can I have your address? Then you politely tell them, you called me, you should have my address, have a good day, and you hang up. Or more importantly, if you have caller ID and you don't know the phone number who's calling you, please do not pick up. And if they leave you a message, it might be something worth returning, but 9 times out of 10, they're not going to leave your message. If for some reason you do get a call and you don't realize that it was a scam, next slide, there are ways that you can report these scams, and that information can be found on the slides. We have provided copies of this presentation so you can review it leisurely anytime you want. So finally, I know that I've been speaking for almost an hour. Your head is swimming. You think you understand what I said, but you're not sure because you think, oh my God, I'm never going to figure this out. That woman just kept telling me I need to do the research, I need to look, I need to do this, but I'm not really sure what to do. So we are here to help. Here's our contact information. We have a telephone intake on Mondays between 10 and 2. And then there's our email address. If you live in New York City, you can either call 311 or Aging Connect HICAP. If you live outside of New York City, I apologize for not including this information, but if you send us an email at that address, I'll make sure that we can get you the link of how you can find your state health insurance counselor so that can help you in your particular county, or you can contact your local Department of Social Services, Department of Aging, or Senior Citizen Affairs, or older adult centers, and they would be able to get you to a counselor from that particular county for a county-specific assistance. So I hope that I was able to assist you and answer any questions that you may have. I do have I'm sorry, I rudely did not introduce. I do have somebody who is answering the questions, Jackie Claris Benitez, our paralegal, who was answering all your Medicare as they were coming in. Any questions that I haven't touched upon?
Yes, we do have one that I wanted to have you respond to live. So
Sure.
Priscilla asked, I started my Medicare Parts A and B on October 15th, but did not finish as I am still covered by group plan and being paid for vacation time. I will turn 65 in January when my vacation time has been exhausted. I am not too late, right? I don't want to incur lifetime penalty.
So if you've already enrolled, so Medicare has this rule that when you turn 65, you're supposed to magically know when to enroll. I encourage anyone, when you turn 65, you enroll automatically in Part A. If you are actively working and get insurance through that active employment, you don't have to enroll in B, but you can. You'll just be charged a copay. And then depending on how many employees your employer has will depend on who's primary and who's secondary. As for Medicare Part D, if you are actively working, you don't have to enroll in Part D. Your active enrollment stops. So if your active enrollment is stopping as of October 15th, I would encourage you to enroll in your Part D plan. You're right on the cuspis, but I would encourage you to enroll in your Part D plan on in November, so that is effective December 1, because technically your 60 days ends on December 15th, because you'll no longer be because they're paying you out for vacation, that might not be considered to be active employment. But you have my email because I have to reread the regulations. So I'm sorry. To be safe, enroll in November. You have the coverage for Part D in December. Or you can wait till January and you may be charged a penalty of 1% of the Part D premium, which is about 50 cents. But there might be some wiggle room for you in this particular scenario. But it's 60 days from active employment for you to enroll in Part D. And I'm sorry if I confused you.
Okay, thank you. Now, there was another question I liked that I did respond to in the chat, but I figured I would be good to answer live as well. So someone asked, what's the difference between deductible and out of pocket?
So I'm sorry, I didn't talk about the maximum out of pocket, and I apologize. A deductible is the time in which it gets you through the door. So you pay your entrance fee of a certain amount that they've specified, and then then your insurance company, the door opens up and they'll start to pay. As your if you're in a Medicare Advantage plan, there's a maximum out-of-pocket cost, which means that they have another magic number, and once you've paid that magic number out, the door is going to be wide open, and you're going to have a wild party because you will not have to pay any care going from that point on. In 2026, the maximum out-of-pocket will be $9,250 on a Medicare Advantage plan. Original Medicare does not have a maximum out-of-pocket at all.
I believe those were all the questions.
Okay. If anybody does have any other questions, I do encourage you to email us. If you have any, if you need assistance with trying to find plan finders or options, please, you can give us a call or call 311. And we will get back to you. Just so you know, our return time is somewhere between 3 to 5 days. We are a very small unit. We're mighty, but very small, and we do try to respond as quickly as possible. And you will eventually get a response from us. Or call 311 and try to get a different counselor who might have a quicker return time.
And thank you so much, Kelly. Thank you everyone for joining us today, and thank you especially to Kelly and Jackie at NYLAG.